Okay, perfect. So we're going to go ahead and get started. I would like to welcome you all to this webinar and also thank you to Kismet Health for joining us in this collaboration. So we are here to talk about shaping the future of pediatric telehealth, and Kismet will provide insights on their innovations and also our iCAN youth feedback with their founders. So we're very excited to have them all here. And as a reminder, this is a webinar. So we are going to first leave the first part of the webinar to questions between myself and Abby, and we'll do a brief introduction, and also Christie and Arwin. And then as you feel like you have questions, put them in the chat and we'll address them later on in the session. Okay, Abby, next slide whenever you're ready. Thank you. So some of us have used Zoom before, and we're on Zoom right now. So how many of you use Zoom all the time, and what do you use it for? I want you all to go ahead and put that in the chat. Perfect. Jacqueline says she uses it for meetings and education all the time. Perfect. So if you could all just put in the chat what you use Zoom for, if you use it frequently, infrequently. I used to use it as a former teacher. I used it every single day to teach classes via Zoom. Thank you, Carrie. All day, every day for meetings. Awesome. Okay, long distance friendship calls. Love that, Abby. Perfect. So Zoom is not something that we're unfamiliar with. A lot of us have leveraged it in several different ways, whether it's for personal relationships or for our workspaces, but a platform like Zoom can be used in a different space as well. And that's what we're here to talk about with Kismet Health, as they completely transformed pediatric telehealth with their own platform. Next slide, Abby. Thank you. So we're going to go ahead and do a meet the panelists, and we're going to have Dr. Arwin start, and then we're going to go to Christie.
Hi, everyone. I'm Dr. Arwin Cotas-Girard, and I'm a child psychologist. I'm also the head of clinical at Kismet, and my role is to make sure that the features that we're building are clinically appropriate for kids and teens and meet their needs. I also help in sales and marketing to other providers who could benefit from using Kismet with their pediatric patients. So happy to be here today.
Awesome. Thanks so much, Arwin. And also, hi, everyone. I'm Christie Sander, the co-founder and COO of Kismet Health. Unfortunately, our fearless CEO and co-founder, Dr. Sierra Gromoth, is feeling under the weather today and unable to join. She's actually just returning from 6 full days in Colorado, where she was being recognized as a 2024 Aspen Ideas Health Fellow. And she was meeting with everyone, ranging from the Surgeon General to senator offices, government agencies, and also even family offices to really help drive funding towards building the very first multimodal AI model to specifically help families and kids improve their health. And so with that, you can understand that Sierra's role is very much to be the face of Kismet, championing our mission of driving more equitable health outcomes for kids everywhere, and really helping to reduce health disparities across our most vulnerable populations. In other words, she gets to do all the fun stuff. And my role more so on the COO side is to run the business. I span everything from meeting with investors to building out our team, making sure our product is shipping on time, even to who and how we sell it, and just about everything in between. We joke that like if we actually had a physical office, I'd probably be the person that runs to gets the toilet paper as well. So in other words, I'm the person who juggles a million balls in the air, making sure that nothing drops. But as someone who gets really bored easily, I love my job as no single day is the same.
Thank you, Christy. And I will go next. My name is Sabina Schmidt-Goldstein-Becerra, and I'm the newly appointed Executive Director of iCAN. And at iCAN, we prioritize pediatric patient perspectives. And this is where iCAN and Kismet found a connection, and we found that we wanted to give feedback. Our youth wanted to give feedback to Kismet, and we have chapters all over the globe, and we're exponentially growing. We have chapters in South Africa, Mexico, in the United States. We're super excited to be on this webinar and share about iCAN with you and also about our relationship with Kismet Health. Abby, I will go ahead and share, point it to you.
Perfect. Thank you so much. Yes, we're all very excited to be here and to talk, hopefully the first of many of these kinds of webinar series where we talk a little bit about how our kids were able to participate and give their wonderful expert advice to real wonderful life-changing healthcare products that are coming out into the world. But my name is Abby Clark. I'm iCAN's Director of Operations, and work closely with Sabina and the rest of the wonderful team in order to host wonderful events like this, as well as keep iCAN's day-to-day activities running.
Thank you, Abby. Okay, next slide. So at the forefront of this webinar, we're going to be first doing a fireside chat, and that's what I explained before, where Abby and myself will be asking questions to the Kismet Health team. So again, if you have any questions, go ahead and put it in the chat, and we would love to hear from y'all. Okay, next slide, Abby. So we're going to just go ahead, and I briefly mentioned what iCAN is, but we're going to delineate specifically what it is that we do. So our core belief is that we believe that we need to empower every child everywhere to improve pediatric health, medicine, research, and innovation by sharing children's voices and their stories. We believe, in essence, that the child should be the driver of their own pediatric health care. And this is where we have the connection with Kismet Health, and they were able to give feedback to Kismet to actually make changes to their platform in order to have that input and feedback. And so not only do we prioritize the children, but we also prioritize the families as well. We are very holistic in that aspect. And we do study designs, treatment plans, educational materials that we review. And if people make, or industry leaders make those changes that our kids actually suggest, then you can actually earn the coveted iCAN seal of approval. So we're super excited. We hope that we are able to award that also to Kismet Health if they are able to make the changes that our kids actually suggested. And as I mentioned before, we are a global consortium of chapters, and we actually have 36 kids chapters. Again, we have South Africa, we have chapters in Spain, we have chapters in Bari, and we are actually having our annual summit from July 15th to 19th in Bari, Italy, where all stakeholders will come together and hear from our children. We're super excited for that. And we are an official partner of the FDA that works with a wide network of community and industry partners, as well as hospitals, high school researchers, and nonprofits. Next slide up. Thank you. So now we're just going to give a brief overview of Kismet through this video, and Kismet, the actual platform. So we want to show you what our kids actually saw, and our kids actually hopped up on this platform, and they were actually able to navigate it. They were able to draw. It was such an immersive experience for them, and that's how they gave their feedback. So you are actually going to be seeing exactly what our kids saw when they gave their feedback.
Perfect. Thank you.
Arwin here to show you some of Kismet's cool features. What is Kismet? Kismet is a video technology made just for kids and teens. It's different from other platforms because Kismet is creating features that help to engage youth. For example, this is our canvas where you can draw, use backgrounds, and add stickers at the same time as other people on the call. We have different categories of backgrounds such as outdoors, indoors, and health. Let's make an underwater scene together using a background. Now, let's add stickers. Like the backgrounds, we have different categories like food, medical, school, buildings, backyard, people, animals, vehicles, and household. I'm going to add a crab, a jellyfish, and a shrimp. The shrimp looks big, so I'm going to resize it by doing this. I can also flip it around. I want to draw my own fish, so I can go back to the markers here and I can choose which marker color and size I want. You can use the eraser to erase it and choose the size of the eraser as well. If I don't like what I made, I can use the hand tool to move my stickers or drawings. You can also press backspace to delete any drawings or stickers I don't want.
Wonderful. Thank you so much. So thank you so much, Arwin, for creating that cute little demonstration. Let me go ahead and go on to the next slide, and we'll get to that in a little bit. But first, we'd like to ask you, Sierra and Arwin and Christie, what inspired you to create Kismet and focus on pediatric health?
Yeah, happy to kick us off. And thank you first off to the iCAN team for having us. You've been such an incredible partner and just really bringing invaluable insights in the youth space and the ability to kind of gain that real time. So really appreciate the opportunity to be here today. So a little bit about Kismet, and thank you for again, Arwin, for creating again like that wonderful demonstration. Really at the core is our ability to engage children using their language of play, but really also driving that as a way forward to create more equitable outcomes across the deepest of populations. And really, this is really born out of a lot of Sierra's background, if she were here today too. So she's here in spirit. But a little bit about Sierra, she's actually native Alaskan, and growing up on the long Aleutian chain, the long tail of Alaska, really her two options for care were either by telephone or medevac. And a lot of that is still true for her home population today. And so fast forward, she, practicing as a child psychologist within the Bay Area, she found a lot of the same barriers to access where children and families perhaps couldn't afford toll money for or like gas to actually come into her office for session or to take the time off work, working multiple jobs or pulling kids out of school. And so she always knew that technology had to be a part of the solution in order to drive more equitable and quality access for everyone. With that, she actually designed and deployed the first telehealth program for Solano County, Northern California, about 5 years before the pandemic, and just really painfully saw how a lot of these existing solutions are really designed for adults and workspaces, but not necessarily for the unique needs of our youth in mind. And so for me, similarly, I actually grew up in a tiny, tiny town in the Upper Peninsula of Michigan, where a lot of also same thing, access really continues to be this problem. And, fast forward for me personally, a lot of my career has been in Silicon Valley. I've spent time at Apple, at Nest, at Google, really focused on building, launching, and scaling first of kind products for almost 15 years. And about 3 years ago, actually, this came to a screeching halt when I was in a life-threatening accident. And I think it's one of those situations where when you get a second chance, or when life really gives you a second chance, you really dig deep about what you're passionate about. And for me, that was all about how do we ensure the well-being of our future generations? And after being, in big tech and experiencing burnout, not only for myself, but a lot of our colleagues and friends around myself, I learned that from Dr. Sierra that the best opportunity for multi-generational change is really intervention, specifically ages 0 to 5. And so that's really why we started Kismet and are excited to be on this journey together with Dr. Arwin.
So Dr. Sierra and I are actually friends from graduate school and have known each other for a very long time. I was approached by Dr. Sierra with her idea for Kismet when the COVID-19 pandemic happened. And at that time, we were worked together as child psychologists at a nonprofit mental health agency focused on children and families. And we had no infrastructure whatsoever to go completely online when the lockdown happened. We had to use what was available at that time, which the agency, I think, had Skype and maybe Zoom towards the end of the pandemic, and it just didn't work well for kids. These platforms were built for adult meetings, and so we actually spent a lot of time trying to make it more engaging. We did things like dressing up our dogs, or we created cardboard backgrounds and made up games to play with our patients, and it was really a lot of work. So at that time, Dr. Sierra decided that since we didn't have a telehealth platform made specifically for kids and for child providers that we could use, we had to make our own solution. And that's how Kismet was born. And I've been on this journey with them for the last year and a half now. It's been great.
Thank you, Arwin, and thank you, Christy, for sharing a little bit about yourself and your inspiration for the Kismet Health platform and, really transforming telehealth as we know it. So, can you describe your journey to becoming key players in a telehealth platform specializing in pediatrics?
Sure. Our journey, as Dr. Arwin really mentioned, started about a year and a half ago when we first started raising our institutional round to tackle this critical space. And I think looking back, the pandemic really shined a giant spotlight on this gap in technology that just wasn't working for kiddos. I mean, I'd love to actually hear in the chat, and we'd love to make this interactive. So feel free to drop questions as we go along. But also, I'd love to hear like who on this call also experienced some type of challenge with, distance learning or Zoom during the pandemic. And I think for a lot of us, if we reflect back, maybe painfully, whether you were a parent, a kid, a teacher, or even a provider, I think there was like really this shared difficulty that we collectively experienced as a society. And so I think, for us, we really capitalized on that moment, and we found that it was really well received, not only by families, but also by pediatricians. I think oftentimes what we find is that companies are oftentimes built for adults, and then we try to squeeze down that solution for kids or scale it up for elderly populations. But the reality is that, as we all know, kids are not tiny adults, and our youth and our elders have incredibly unique needs that really deserve solutions that are tailored to their specific needs. And so, we found that this was really clear and came through at the end of our first calendar year as a company. So we started 2023, and it was just Sierra, Dr. Arwin, and myself, and this beautiful idea. And by the end of December, we had won a Pediatric Innovation Award from Oracle Health and Children's National Hospital, which has just really been kind of the catalyst and fuel for our growth and development in this space.
Thank you, Christy. And I love how you emphasize that, kids are not just tiny adults. We have to contour things to fit their specific needs. Thank you. And then I'm going to go ahead and hand it off to Abby to ask the next question.
Thank you. So what was the development process like for Kismet's telehealth platform?
Great question. If I had two words, it would be the Fast and the Furious. I guess that's four, but the descriptors. I think, we were really fortunate with the lived experiences of both Dr. Arwin and Dr. Sierra paving the way. Being a platform that's really built for and by providers, we knew a lot of the pain points that we needed to solve for. And between the two of them, we had a decade worth of collective experience and time of dreaming up their ideal solution. But we also just didn't stop there. We really had surveyed hundreds of clinicians to get feedback on what they would like to see. We ran a successful pilot where we engaged families to better understand what their experience was like using Kismet over a 12-week period. And really for that pilot, our hypothesis was that better engagement would lead to better outcomes, and it really did. Prior to actually starting the pilot, we had engaged a number of large payers who said, if you could just prove 30% engagement, you would be quote unquote knocking it out of the park. And that's hard because that means less than 30% of the time our kiddos completing actual telehealth sessions because it's not really speaking their language. And so not only were we actually in the high 90s in comparison to that 30% industry benchmark, but we also were excited to actually exceed the developmentally appropriate time in session by almost 2.5x. I remember this particular family with a 5-year-old, and they were like, my 5-year-old won't even sit long enough to watch, TV for more than 5 minutes. Like, what makes you think that you could actually engage them in session for 15 minutes, which is what's developmentally appropriate for that age? And for that same kiddo and others, we actually were able to engage them consistently over the 12 weeks for almost 45 to 50 minutes. And then it actually required us to change our care delivery model as the parents weren't getting the support they actually needed. And so, ultimately we had a really small but mighty engineering team. We were able to get the alpha product up and running for the pilot in just a matter of 2 months. And then shipped and launched kind of quickly our initial MVP just a few months after that in time for Telehealth Awareness Week. So fast and furious, but amazing.
Certainly sounds like it was an incredible journey, and I'm so glad that the product has continued to exceed expectations and deliver some wonderful help for the kids around who will need it. All right, Sabina, off to you.
So what challenges have you faced in developing Kismet's technology, and how did you overcome them?
Yeah, no, it's a good question. I think reflecting on even like also my Silicon Valley days, like no product or technology is shipped without bumps in the road. But this is even more critical than, iPhones, which is what I was making before, because really these products are centered around not only health, but children's health. And so we always that was kind of our core guiding principles from day one. We've always designed for the patient perspective first and solving for the safety and privacy of kids as our patients. And so I can remember a couple of instances where, as we were racing towards our initial launch, there were a number of really flashy features that we wanted to showcase. But ultimately, we had to make a really tough call to descope, or like even delay some of these features just because of the level of complexity related to patient safety. And so simple features that we thought would be helpful clinically or delightful for children and teenagers, but they really required a lot more of that thoughtfulness and thoroughness because it had implications on patient data that we wanted to make sure we got right. So kind of going back to our guiding principles of patient safety and privacy above all else, it might slow things down as it relates to kind of the pace of innovation that we're working at, but it's also paramount just to who we are as a company and our mission.
Thank you, Christy. And I love how you guys took a halt and really thought about like what's in the best, what best fits these kids again with everything that you do. Okay, Abby, handing it off to you.
Mm-hmm. It certainly sounds like very admirable, again, as Sabina said, to put the needs of the kids and the patients kind of first over, in order to ensure that it is engaging and correct for them. How do you ensure that Kismet's telehealth services are not only engaging, as we've spoken about, but also effective for their medical needs?
I can take this one. Dr. Sander and I have worked with kids for over a decade each, and from our own professional and personal experiences, we really got to know what could be helpful for kids and for the people who work with them. Also, we know that kids benefit from expressing themselves through play. I was a kid once, and I'm a grown-up who loves to play, so that helps us when thinking about how to engage young patients. But we also know that personal experience is often not enough because someone else could have a different experience or opinion than us. So we also did a lot of research. We read a lot of articles published by other providers on working with kids through telehealth, and it was especially important for us to make sure that Kismet is inclusive of diverse medical needs and backgrounds. So we really looked for those kinds of papers that were being put out by providers who worked with many different children of medical needs. So we spent a lot of time gathering information from child providers as well to better understand what they need from video technology. And before we even started working and building the platform, we surveyed over 1,000 providers about these needs. Also, seeking feedback from kids and teens have been so valuable in better understanding what they need most and hearing from them directly. And I'm really curious for the kids who are on this call, what features and tools will be helpful for you to communicate better with your medical providers? And if there's any providers on, what tools or features would be most helpful for you to communicate with your pediatric patients? If you'd like to drop that in the chat.
I will also write it in the chat so that people can see the question. There we go.
Thank you.
And we'll let you go ahead and respond at your leisure. Thank you, Arwin, for again emphasizing you always went back to what the patient wanted and what the population that you were serving, what best fit their needs. So how do you ensure the safety and reliability of Kismet's telehealth platform for specifically pediatric patients as they are a vulnerable population?
Yeah, I can take this one. I think, as both Dr. Arwin and I mentioned, I think safety and reliability have just always been at our core. And going back to being built for and by providers, we really hold patient safety in the highest regard. And I think there's a couple of areas that we're really focusing and doubling down in this area. It's really through this lens that we actually recently brought on a gentleman by the name of Jonathan Simon. He actually was the founding CTO of Brightline previously, which is a mental health care company focused on kids and youth. And he recently joined our team as our fractional CTO and is just making a tremendous impact from day one. And he's actually also partnering with a chief information security officer to make sure that we're building everything safely, reliably, and also in compliance with the highest of standards. So, I think these are all core to kind of the base product, but even beyond this is really where Kismet's really excited to be an industry thought leader on also the ethical and responsible use of AI for families and children. And that's core in terms of how we've been building the product and incorporating, both consent and assent into our platform from day one.
That's amazing that you have that built within your platform specifically, because assent and consent are super important. Thank you, Christy. And then I'm going to go ahead and hand it off to you, Abby.
Sure. So why did you all decide to seek feedback from iCAN Kids?
As we've mentioned many times now, the feedback from kids is really the most valuable thing as we're creating Kismet. We want to make sure that it's built specifically for children, and it's so important for us to make sure that we put kids' voices at the forefront. And we thought, what better way to do that than to partner with iCAN Research? iCAN's mission of empowering your pediatric patients and sharing kids' voices really made us the perfect match to do this type of research with each other. And it's also super important for us to make sure that Kismet is inclusive and can be used by all kids of all different needs and medical backgrounds. I'm curious, for any children here, would you be more excited to use technology if you helped create it, or if you knew other kids gave their ideas to make it better? And we're going to drop this in the chat as well.
Thank you. And I know we have a couple of our chapter leaders on the call too. So if you wanted to respond to this question from your perspective, as those who work one-on-one with the kids, we would welcome it.
Thank you. So I'm going to go ahead and present the data from the actual study that we did with Kismet Health. So Abby, if you could go to the next slide. And this will give you somewhat of a more nuanced understanding of our kids' feedback, specifically with the platform that you saw in that video. So about our participants or our youth members, these are the iCAN kids. So most of the participants in the focus groups, I was the one who led all the focus groups. Most of them were 8 to 10 years old, and then some way less than 50% from the 8 to 10 were 12 to 18 years old. Next slide, Abby. Thank you. So before we even started the survey, we asked the kids to actually identify as having a specific learning disability, being neurodiverse, having speech or language disabilities, physical disabilities, or none of the above. So we did have some kids who identified as neurodiverse, with the majority identifying as none of the above. However, when looking at the data, those who identified as neurodiverse had very similar answers to those who also identified as none of the above. Next slide, Abby. Thank you. So with regard to the kids superficially answering the question, is Kismet better than other platforms I've used? And I'm telling you, these kids have gone on every single platform. They use platforms that I have not even heard of to interface with their friends, but we're talking about Google Meet, Zoom, FaceTime, and 91% thought that Kismet is better than other platforms that they have used. And again, as Christy said, they're surpassing that 30%. Thank you. Next slide, Abby. And In terms of ease of use for the Kismet platform, they rated it on a scale of 1 to 10, 1 being extremely easy, 10 being exceedingly hard. 83% of our iCAN kids actually found Kismet neutral to extremely easy to use. So even when I was on the platform with them, they were easily able to navigate, the stickers, the drawings. I didn't really have to actually tell them exactly where to go. They knew right away. They already started drawing before I even told them to. So it was very easy to navigate. Next slide, Abby. So in terms of how much they liked using Kismet, again, on a scale of 1 to 10, 1 being did not like it all, 10 liked the most, 87% of participants liked Kismet. And they also commented on how they would feel if their doctor, nurse, teacher, or therapist used Kismet with them. And very surprisingly, 78% of our kids thought that they would prefer to use Kismet than actually meeting in person or felt neutral, which is very surprising data to me, because especially as a former teacher and someone who actually used the Zoom platform to teach, a lot of these kids, wanted that in-person connection. But with Kismet, I think that they felt so comfortable within the platform with the drawing, and also, just the fact that the actual video platform was crisp and they could actually see each other much better. I think that's why they felt so comfortable as to that. Next slide, Abby. So these are some comments that our kids actually made to try to actually make changes to Kismet. So I was very, very surprised. I never even thought of this. There was an iCAN kid who said, I think we should make an AI tool where, what if people can't draw and they don't have the fine motor skills? They should be able to speak to Kismet and say, draw this for me, which I thought was so remarkable, because this kid was 8 years old and he already knew about that. Also, they also said that they would want to add more stickers and more customized backgrounds. That's something that, of course, Kismet Health could do. They talked about maybe even being able to search images from the web and incorporate them into the actual whiteboard, and also, making their own drawings, taking pictures and putting them and uploading them as well. They also wanted more games to be incorporated. So existing beyond just the drawings and the stickers, like Roblox and maybe playing chess with your telehealth therapist. They like the idea of play, just like Arwin said, play is everything for these kids. So we have to make it engaging. And then they also, again, with the backgrounds, and they just thought, to have the idea of having more things within the platform that allowed for that play aspect. Okay, next slide, Abby. Perfect. So with that said, they talked about, things that they would like to add. They also talked about what they did not necessarily like about Kismet. So one thing is that one of the kids who is in the group, he actually tried to use the Kismet eraser tool to erase his drawing, and it wasn't adjusting size for him. And so he was literally focusing on every single speck and trying to erase it. And I understand, as a kid, I would want to erase it before I started completely new. So that was something that he definitely wanted to focus on. Another thing about Kismet is that it has a locking feature. So the telehealth therapist can actually lock everything. So this kid is not able to, drop the call, turn off the camera, etc. A lot of the kids actually made comments about that, and they're like, I feel like I don't have ownership over this platform, that I can't take control. And I understand that, because with Zoom, I mean, I'm sure we've all experienced it. We can go on mute, unmute, but if someone mutes us, we can't necessarily unmute anymore. And if our camera's turned off, we can't control the camera. But this one, you can't even leave the meeting if it's locked. So, but I understand, because you're trying to get the kid help with telehealth therapy. So they just felt that that was really uncomfortable for them. So that's a feature that they did not necessarily take to. And then the chat box, something that I think that they're used to is on Zoom. You can expand the chat box and write more than a couple words. They felt that it was restricting and that it discouraged from sending long messages. But then, there were those kids who said, no change, nothing. I love everything about this app. And there were kids who were like, let's use it right now. Like they were very, very excited to use it immediately. So we had a lot of feedback from our kids, and we're super excited to see how Kismet Health will actually leverage this feedback from our kids and allow it to drive their actual platform. So with that said, on Kismet, how do you plan to use the feedback from iCAN into Kismet's platform?
We're so excited to get these results, and we're already incorporating the feedback we received from this research with iCAN into our product roadmap. And it was so nice to see that many of the participants' ideas actually aligned with what we already had in mind for Kismet. It was super validating that we're on the right track. It also helps us to prioritize what we want to work on next. And we realized that we need more games, we need more interactions, and the participants gave us some ideas about which games to add first, which is actually a question I'm curious about. What kind of games would you ideally like to see and why for audience members? Um, we're also making sure to improve Canvas's functionality to make it even easier to use and have users add their own backgrounds and stickers as was suggested, and also something I've been asking for from our engineering team. Some of the feedback really surprised us, as you're mentioning. Um, it was just so insightful, and I was so surprised pleasantly by it. So the person, a child who said that we incorporate AI to help patients who have difficulty drawing with a mouse or trackpad. I thought that was such a great idea, and we really hope to do something like that in the future.
Thank you so much, Arwin, and thank you for incorporating our kids' feedback into your actual platform. And we're super excited to see the games and interactions that you're going to come up with to address that. And I would personally love to see the AI incorporated where a kid could actually, just say to the platform, draw XYZ, and it's drawn. And then making sure that the canvas's functionality is easy to navigate, even though a lot of them already said it was easy to navigate. So we appreciate that you're actually going to make the changes and allow for, patients to actually drive this platform. Thank you.
Thank you. So we talked a little bit more, or we just talked a little bit about the different changes and suggestions. Christie, do you have any kind of thoughts on what changes from the suggestions that our iCAN Kids gave that you could implement now? Or are there some changes that could be delayed?
Yeah, it's awesome. I think first off, just echoing what Dr. Arwin said, like getting feedback from iCAN's youth members was gold. Like there's so much good insight here, and just the ability to have that real-time insight and have a conversation around it is just a really incredible opportunity. So I think certain things like resizing the chat window are a little bit more straightforward that we can actually implement sooner than later. I think the insight that was super valuable also for us was to learn that, the focus controls or locking features, as they called it, really led to that loss of control over their own decisions. And it's one of those situations where it actually is not our intent. Our intent is not about taking away autonomy, but rather really to protect them, especially for kids under the age of 5, where they're perhaps too young or not physically able to. And so we don't really see this as a case for older kids. It's more so to help the provider be able to help control the environment, especially for families who maybe aren't as familiar with technology, or perhaps they have older caregivers like grandparents who also have a really hard time with technology. But ultimately, I think this is something we can actually build in with, consent and assent at the beginning, potentially notifications, or even into kind of the age appropriate designs that we're implementing over time. But it's also a topic that we'd love to learn more about and actually get more input on to actually identify a meaningful solution that works for everyone. So I think for us, the biggest learning that we took away is that, this getting feedback real time and the perspectives of our youth are super critical.
Thank you so much, Christy. I think that's incredibly well said. And there's definitely obviously a lot of thought that has gone into behind every single feature that you've developed with Kismet. And we are so excited that our iCAN kids were able to provide new insights and maybe different frames of thinking around some of the features. And we're excited that we're able to help implement and make the product even better than it already is. All right, heading off to Sabina then.
Thank you, Abby. So I know you talked about this a little with, your aspiring to incorporate AI and in aspiring to also incorporate, changing the chat box size. But what are your future goals and aspirations for Kismet overall?
We love this question. I think like at the very beginning, or kind of this, we talk about it in terms of like acts 1, 2, and 3. And currently, while we're in act 1, which is really about engaging children and kind of having this playfulness so that we can really speak the same language, that actually translates a lot into kind of how pediatric healthcare is delivered in general. And so in a time where we know that, 30% of pediatric residency positions went unfilled this year, meaning that there's a decline in the overall number of actual pediatricians available. We also know that a lot of hospital systems are pushing care outside the four walls of their hospitals, right? So how do we really treat kids wherever they are and meeting them where they need it most, right? Whether it's at school or whether it's in their home. And we also know there's a lot that's actually moving towards collaborative care. And so how do we really facilitate better care across the entire team, whether it be a primary care physician, a kiddo's neurologist, maybe their therapist. And so there's a lot of these interesting kind of trends that are happening within the space. And those are really the big themes of what we are tackling. So really being able to use the video components of this to actually kind of determine patient acuity and triaging and being able to automatically route that to the right department so that kids and families aren't sitting, 9 months on the neurologist wait list trying to even see if there's a problem, but they could actually get prioritized if there is, or potentially not even have to go in for that full evaluation. And ultimately, really where we see this going is the development of the first pediatric, what we call a multimodal co-pilot. And really that's the ability for us to glean insights from not only what kiddos are saying, but also through a lot of other data puts and signals to actually deliver kind of real-time diagnostics as well as interventions to really get faster time to accurate diagnosis and really focus on the treatment plans that work best for those kids as well. So all in the spirit of kind of health equity, especially for underserved populations that we've been talking about.
Thank you, Christy. I love your emphasis on health equity and how you completely understand that a child exists beyond, those hospital walls, that we need to look at them in a holistic approach. So thank you, Christy. And then I'm going to go ahead and hand it off to Abby.
Great. So how do you think that Kismet will change the landscape of pediatric mental health care in the future?
Yeah, no, this is such a good question. I think, when we go back to kind of the common theme that we talked about with like health equity, that's really our ultimate goal. And so I think like really for the first time, there's an opportunity for us to have, unidentified or kind of anonymized, if you will, aggregated insights on pediatric healthcare. I think when we think about how this has historically worked, there's just been a lot of fragmentation across all of the systems. And so where we really see the opportunity for Kismet is to kind of be that connective tissue to span different pediatric providers wherever a kid might be seen. So whether it's the school nurse, the clinic in your own backyard in, the Upper Peninsula of Michigan, all the way to your nearest children's hospital, having the ability to actually be EHR agnostic and spanning all these different places, we are able to then up level that level of information and really gain insights and lead to potentially first of kind diagnoses, things that don't yet exist, or even being able to talk about what is best in class treatment plan or intervention for a particular group, meaning, for a Chinese girl ages 3 to 5, this is actually the intervention that works the best and it's culturally competent, it's personalized. And so I think where we're super excited is actually the ability to really influence the future for how pediatric healthcare is delivered. and ultimately driving towards those equitable outcomes that we talked about. But, I think with that being said, we'd also love to hear back from the audience, like what future goals and aspirations also might you see and personally have for Kismet? Like, where do you see is actually the biggest impact in changing the landscape of pediatric healthcare?
Thank you so much for those insights, Christy. Great. And so I think that we are looking to kind of answer some of those questions about the chat, but also feel free to ask your own, as I think we're kind of approaching our kind of Q&A part of the session.
Yes. So one of the questions that we do have is, Christy, Arwin, can you address how Kismet Health can cross state lines or even international boundaries? Because I know our chapter leader from South Africa wants a demo too. He's super excited about it. Will this be a big challenge for you?
I think what we've noticed is that there's been some confusion about Kismet being a direct provider of services or not. And I just wanted to clarify that we are not currently providing direct services, although we did have this model in mind for the future and also had conducted the pilot study with clients over the summer last year. But right now we are a subscription-based service, and so we don't foresee any challenges with using our platform in different countries or different states, as long as the provider themselves are abiding by their state or country licensure regulations and laws. And Christy, maybe you might have some other thoughts around that.
Yeah, I think just echoing what you mentioned, like we are SaaS technology. And so I think what's beautiful about that is we don't necessarily have like the state-by-state regulations that there are oftentimes in telehealth. I think with that being said, we are actually quite active in policy making around telehealth, period. Particularly within the United States. So, I think post-pandemic, there's a lot of policy kind of changes, things timing out, the evolution, and like that really takes away from all of the remote, rural, and underserved populations that have really benefited from it. So we are taking a pretty active stance to really further kind of, policies that in support of telehealth. I think when we think about across internationally, certainly there's more as it relates to kind of different types of compliance aspects of it. We actually are in very deep discussions with a particular health system in Canada. And so working with a CISO there to make sure that all this is kind of the utmost kind of compliant and ensuring security and compliancy kind of requirements there. So I think as we continue to expand internationally, that will always be the lens that we take. So really partnering with kind of local CISOs to make sure that we're up to date on the requirements for each country.
Thank you, Christy, and thank you, Arwin. I know you kind of answered Huyen's question, but I would like it to be addressed whole group. So what if some of the barriers that technology provides actually makes it more comfortable? And so she was talking about a softer transition from remote to in-person, or physical barriers like they hate car rides and getting ready. So this is actually one of our iCAN youth, and I would love to hear your insights on this.
I love this conversation. I just wanted to keep typing to you in the background and getting more. And thank you so much for offering up just like that wonderful idea. I think there's a lot of opportunity here. I think when we think about even like the future of healthcare and also the way that our youth operate in the world, it's no longer just in person. It's no longer just telehealth or virtual. It's like this seamless kind of aspect that goes back and forth between the two, or kind of like this really hybrid setting, right? And I think that's how we think about also the use of Kismet. We've actually talked to a number of health systems that actually want to use Kismet while kids are in person in their pediatrician's office. And they're excited about being able to, let's say, hand, the kid a tablet while and drawing or doing some of our clinically informed games, while they're there in session in person, while the pediatrician's then having a conversation, let's say with mom, dad, caregiver, whomever it might be. And doing so still allows for us to capture those clinical insights and track that over time. And so there's a lot that can happen kind of like around those two things. There's also things that we've been talking about with, like, I think to Hoyung's point, like around maybe having avatars, for example. So an ability for you to kind of like choose your own avatar, or choose kind of the representation of how you're feeling that day. So that way it may not be your exact face or background or different things like that. But it also can help to kind of bridge that conversation there. So I think there's a lot that we can and will be doing in this space. And I think that's where opportunities like this to hear directly from our youth is so important. And Huyun, if you have any ideas, like please do let us know. It's something that I think is so invaluable. So thank you for offering that.
Yes, and Huyen and Calvin both had the same question. Does this app actually cross language barriers? So what if a provider and kid don't speak the same language? Is there any translation feature? Is that in the works?
Oh my gosh, you all are like, this is like my happiness of joy of being in this conversation. Yes, and it is in the works. I think going back to kind of like our pillars that we talked about with like privacy and security, health equity being another one, like that is certainly something that is very near and dear to our hearts in terms of English as a second language, or kind of just languages in general. So, I think there's a lot that's happening also just within the space around real-time translations. We rely a ton on interpreters today, but like interpreters are hard to scale, and the ability to do that effectively. So there's actually a lot of work that's being done, I think, within the healthcare AI industry in general about real-time translation. And that is something that we're continuing to actively take within our roadmap. And then also as it relates to even American Sign Language. So looking at, kind of how do we be more equitable in all shapes and forms.
Perfect. Thank you, Christy. And again, love the emphasis on equity. So with that said, and if you have any more questions, we can definitely send them to the Kismet Health team. But I want to kind of ask you just the future of Kismet. So how will Kismet continue to incorporate feedback from youth and other stakeholders in its future development?
As I said earlier, we're already incorporating the feedback we received from our research study, and we do this as a team by presenting our findings to our entire team and collaborating on what to prioritize for our next update release. We want to make sure that we're really listening to what the participants suggested and that we address them all the concerns, even if it means that we'll be a lot further on in our future development. So it's really a continuous process to incorporate the feedback we already received and plan to receive in the future.
Thank you, Arwin. And Abby, I'm going to go ahead and hand it off to you.
Perfect. Thank you so much. So what are your plans for enhancing user experience on Kismet's platform in the future beyond interactions with iCAN?
Sorry, I was unmuting there. I think certainly first and foremost, continued interactions with iCAN. I think the more that we can lean into the partnership too, to the point of like Kelvin, certainly youth and culturally and geographically across the globe will also have such good insights. So wanting to really lean into and kind of find those strategic opportunities to learn more. I think also beyond this, there's kind of two ways that we're also thinking about just like continuously capturing the voice of the customer. I think one is there's this unique opportunity that we have to actually form a kids advisory board. Certainly we see this a lot in the provider space, but if we are building this also with the intention of our youth in mind, like certainly they need to have a strong voice in how we continue to develop this. So I think the kids advisory board is one. And then the second is that we are actually opening up 2 spots for a design partnership with a number of children's hospitals. So really being able to get kind of that real-time active feedback from providers as well on what would really move the needle for them, and kind of like integrating at a very early stage. So we have 2 spots that we're opening up later this year, but already in pretty deep conversations with a few of them.
Thank you, Christy. And how will Kismet leverage emerging technologies like AI and machine learning in its platform?
Yes, we love this conversation. And going back to, again, like kind of the ethical, responsible use of it. I think, AI is interesting. It's advancing and kind of moving so quickly, but a lot of that development has actually been in the large language model space. And one thing that we're not surprised by, but is a pretty staggering stat, is that ChatGPT actually showed an 83% error rate when it came to diagnosing kids correctly. So meaning there was an 83% misdiagnosis rate for kids. And it's not surprising, right? When we think about large language models, it heavily relies on children's vocabulary, their linguistic capabilities, and their ability to actually articulate the symptoms and what's, kind of what's wrong that day. And so that's where we're really thinking about this in more of the kind of multimodal aspect of it, and layering in video as it relates to movement, layering in biometrics to really understand more real time, and triangulating across that to really drive that kind of faster time to accurate diagnosis and intervention time. Yeah, Kelvin, it's really scary. 80% for ChatGPT. I know, it's wild.
Abby, I'll go ahead and hand it off to you.
Thank you so much. Are there any future initiatives aimed at improving accessibility and affordability of Kismet's healthcare services?
Yes, and actually, I love this group because we covered part of that, which is going back to kind of language, right? Like going back to health equity, and we're such a melting pot in this world of different languages and backgrounds, and having the interpreters that are difficult to scale. And so we see this as actually really being also critical for building not only remote and rural kind of connection, but also for our underserved communities. I think going back to Dr. Sierra and her Indigenous background, so much of their care is really through also storytelling and developing kind of those cultural aspects that you can build in. And so we're really thinking about this in terms of not only access for remote, rural, and underserved populations, but also what makes the most sense for them as well.
Thank you. And what future research or focus groups do you plan to undertake to validate Kismet Health's effectiveness?
Well, since this feedback is invaluable to us, we really hope to work with iCAN kids again in the future to get this feedback as we continue to expand and add features. And in addition, we'll also be doing more research with pediatric providers on their experience using Kismet with their patients by partnering with our current customers.
Thank you, Arwin, and we would love to continue to work with Kismet. And then Abby for the final question.
Yes, I know we're right at time here. Thank you everyone for staying on. Thank you so much, Amanda. We appreciate it. If you have any last lingering questions or would like to get in touch with Dr. Arwin and Christie and Kismet, please do come on. We have one last question from our series here. How do you plan to continue getting feedback from children and youth, and how will you incorporate this into the developmental cycle?
Besides working with iCAN, hopefully we can also get feedback from patients who are being seen on Kismet by their providers. We'll be incorporating a lot of opportunities to give feedback directly into the app, so it can be based on the user's real-time experiences. And really our goal is that with each new feature that we release, we can also get feedback from kids about it so that we can only continue to improve on what we built so far. Like Christy mentioned, it would be so cool to have a kids advisory board for this type of thing.
I agree. So with that said, we really are grateful for all of you hopping on to learn about the Kismet and iCAN collaboration. And I know that, oh, Abby, sorry, if you could click on the next slide. So we all discussed the future of Kismet, and then next slide, sorry, one more. Perfect. So you can learn more about how providers can unlock quality care for families everywhere. You can visit them at kismethealth.com, or you can also contact them via that email. We are super excited to continue to collaborate with Kismet Health. They are changing the entire landscape of pediatric telehealth. So we are very excited that they are going to use our kids' feedback. Again, if you have any more questions for them, you can definitely send it to us, and we would love